Welcome to the Concierge Medical Marketing Podcast, the show dedicated to helping concierge medical practices grow and thrive. Hosted by Stephen Schwartz, a digital marketing expert with over 25 years of experience and a passion for improving American healthcare by helping concierge medical physicians succeed. Here's Stephen Schwartz.
Hello and welcome to the Concierge Medical Marketing Podcast. I'm your host, Steve Schwartz, and it's truly my pleasure to have you along on our discussion today. I am so thrilled to speak with Dr. Aida Khanum. Aida, thank you for being with us today.
Thank you for having me.
Truly, my pleasure. And we met recently through LinkedIn. We've had a great conversation before hopping on our recording here, and I just really wish I had started clicking the record button before because you had so many wonderful things to say. What I'd like to do is let's start with your background, and your practice is in pediatrics, which is super exciting, working with kids as your specialty, but not just kids, but kids in a DPC concierge arrangement. So could you please share with our audience your background? Why did you want to become a doctor? And then what led you to DPC as the arrangement or the structure of your business?
Yeah, well, thank you for having me. So yes, I guess I wanted to be a doctor since I was little. I didn't have any physicians in my house. My dad was a lawyer and my mother was a teacher. And I think just growing up, it was one of the things that was a very respected profession, and I loved kids. And so I said, oh, you know what? I think I want to be a pediatrician. Yeah. So I kind of knew that from a very young age. And I had an uncle who was a mentor. And so he kind of guided me through my, schooling and then deciding to go to med school. So I did my med school abroad and then decided to come to the US for my residency and did my fellowship. So I did my residency in New York, Syracuse, then came down to do my fellowship here at Baylor in Houston, and got a master's in public health at the same time because I had an interest. I speak a few languages, so I had an interest in international health. But then I met my husband, and he said, "Well, yeah, traveling the world's going to be a little hard, so let's just stay and make your little international world here." So Houston's a great city for that. So yep. So then I stayed and went out in the workforce and then opened my own practice about 10 years ago.
Wonderful. And the practice that you started 10 years ago, was that a traditional insurance-based pediatrics business?
That's right. Yes. So I did. So I'll tell you a funny thing. So when I was starting my practice 10 years ago, I actually went to my CPA, and when we were kind of coming up with the business model, and the first thing she said to me was, "Why are you taking insurance?" And I was like, "Huh?" And she was like, "Why are you taking insurance?" She's like, "Don't take insurance, just go and, do like a cash-based model. Don't get into this whole thing." And, I only knew the insurance world, and there was nobody else doing it. I think there was one practice that she had just started and was trying it, but that was it. And so I was like, I think I was a little nervous, and I said, "You know what, this is the first time I'm doing it. Let's just go with what everybody else is doing." And so yes, it was a insurance-based practice that I did start 10 years ago, and then learned a lot of things in those 8 years before when I decided to make the switch to DPC Concierge.
Now, what items specifically caused the turning point to say, I can't do this anymore, or I don't want to do this anymore? I have to get rid of dealing with insurance, and DPC is something you've heard of. How did that happen?
So my colleague who had actually started exactly a DPC practice 10 years ago, I'd heard about her and I kept hearing, and we sort of talked a little bit on and off. And, again, it was hard work for her. But what happened with my practice, I was a solo practice. I, for the first time had to deal with insurance companies and, had to run a business along with seeing patients. So it was wearing two hats, and never realized, because I think until you do it yourself, you don't realize how broken the system is. And so there I would be seeing patients, trying to grow my practice, having to see more patients over the years to generate the same revenue or less, because every year there's no negotiating power. Insurances kept dropping what they wanted to pay for the same thing or fight on everything. I mean, the time that you spend and invest trying to get dollar amounts that just for the basic things to be covered, to cover your overhead, was just becoming insanely ridiculous to the point where I kind of forecasted and looked forward ahead in time and said, you know what, at this rate, the level of care that I tried to provide. So even though I took insurance, I was providing concierge level care. My patients got same day appointments. They had 20 to 25 minutes. I mean, I didn't ever push anybody out. So they got to talk to me, ask me the questions. They got to access us. I mean, it was that level of care without having a membership fee on it, until I was like, okay, now either I have to stop providing that care and see 5,000 patients and double book, triple book, refuse appointments, push them to the urgent care, or make a business model decision, which is what I decided. Because I went into medicine, I like to know my patients. I like to have a relationship. I like them to feel like this is a place where they feel they're in a safe space. And I know I have 3 kids of my own. When your kids are sick and you're calling, first, if you're not able to get a hold of your doctor to even talk to them, that's terrible. And then not getting an appointment and then having people say, come back in 3 days, terrible. I wouldn't wait. I wouldn't wait. I don't know how anybody does wait. And I was like, no, I can't do that. And so, yeah, that's what made me make that decision and leap to changing it over to a concierge DPC a year and a half ago.
Nice. Tell our listeners, how has your stress level changed? How has your profitability changed? Just on those items.
So stress level, I think it's not easy. I think when people say it's, just jump on and do it, I don't think it's easy. I think you still do need to do a work beforehand. It's a different work, a different level of work. So the stress is different, but it's not patient care stress, which I think was nice. So I have the patients that I have, I know them, they literally feel like they're part of my family. They reach out, it's just such a nice, fulfilling experience. I think that has been the wonderful part about it, because there's price transparency. It's not transactional. Money is not, and you should see how people react. I mean, they're always going to the front and saying, do I owe you anything? We're like, no. And they're like, I really don't owe you anything. You spent an hour with me. And I'm like, yeah, no, you're good. You're good. I mean, it's just hard for them to believe, but it's so nice because they are just so appreciative, and their health outcomes are so much better. So I think from that perspective, it's been amazing. But on the other side, with the stress of trying to grow the practice, I think that is hard work. I think because it's about educating the community. I think people don't know what we do. And so the automatic reaction is, what? I don't know what this is. This is something expensive. I don't want to hear about it. Without really realizing what it is that we're offering. And I always tell parents, I say it's concierge level care at an affordable price, at something that's often less than what you're paying right now with very poor access. So I think from that perspective, I think it has been hard work, but learning and growing and great. I wouldn't change anything.
Excellent. Are you at a full panel size now?
No. So I am still growing. When I transitioned, I had patients that joined me directly. Then and as I said, remember I said I was providing concierge level care without a cost. So for a lot of my families, they had never been in the real system and didn't realize what it was like. And so when I changed the business model, people loved the practice and they were like, but now I have to pay. And then so there was that thing in their head, and I was like, it's okay. I said, you go ahead and try it out and see what you want to do. And so I've had people come back. There were people who joined, there were people who left and came back. And then it's also been kind of going out there and trying to educate people and bring on new families. And I offer a meet and greet because I always want to make sure people understand what I have to offer, and I want to make sure it's a good fit. So every month I open up spots to bring in more families. Not full yet, but getting there.
Wonderful. What methods or techniques of marketing, digital or otherwise, did you do that you found were helpful, successful in bringing aboard new families to your practice?
So I think the one thing that I learned relatively quickly was that it is me. I am the product, right? So if, the old style of, I think sponsored marketing and stuff doesn't necessarily work in this model. Networking, creating relationships with the community, I think has been a big deal. People who join are really people who kind of want you. So I think that has worked. Creating a website, I think a website that is targeted towards telling more about who you are as a person. I think if you go to a traditional practice's website, it's usually just information and things like that. But I feel like, and this is something that I learned maybe like 6 months or a year into it. I sort of revamped my website to make it more personal, tell them a little bit about me as a human being. So kind of create that personalized touch so they feel like they're coming to me as a person, not Pediatric Pod, Concierge Pediatrics company. And I think that was a big thing. And then social media. I do a lot of social media education, which I love doing. I really like educating the community. It's all practical stuff. It's not really medical stuff. But I think just being on social media, and I'm on all the platforms, has helped, I guess, make people sort of validate or sort of make me a presence. And then sort of then when something clicks in their head, then they just suddenly are like, you know what, I think this person is for me, kind of make it a more personalized thing. So I think those are the two things that I kind of felt helped.
Excellent. I'm sure you get plenty of referrals from existing patient families
Yes,
who,
100%. Yes.
who, as they say, know, like, and trust you. And so
That's
they
right.
want to refer you to their friends and family. I did watch some of your social media videos, and you're just so personable and so charming. And I think there's something about using video through the internet as a way of helping connect people through, this screen. But in doing so, you're building a relationship, going from somebody who's never heard of you before, or maybe never heard of DPC or concierge, and starting to drop these beautiful, wonderful little videos that are providing education on some topic relevant to a person's health or their family's health or the child's health, whatever it might be. Obviously not providing, personalized care through a video, but as a way of literally sharing great information. And in doing so, people see your personality. People see that you're a person that cares. And when, what's that phrase? People don't care how much you know until they know how much you care. I've heard that one many times over the years, and it's so true. And so using that video the way that you do, I think is so powerful and so appropriate to help you grow your practice to the full panel that you're desiring to reach.
Thank you. That's very sweet of you to say.
Sure. Did you find it challenging to transition existing families to the DPC model? Did you get a lot of pushback, or was it, how did that go?
So, I think it wasn't pushback. I think it was more, I tried to educate. So I really spent a lot of time talking to all my families. I did tell them what I was going to do and why I was going to do it. And the ones that, there were people that were like, I don't care what you're doing. We love you. We're not moving. So they just were like the easy sell. No, it wasn't even a sell, but it was just they would just transition without any problem because they really believed in keeping their care with me. And me looking after their kids. The majority, however, I think, as I said, everybody is so, I pay for insurance, then why should I pay for something else? Was a big deal. I think there wasn't much movement. This is about a year and a half ago. Now I'm hearing a lot more, and there's a lot more in the news and a lot more dissatisfaction with all these surprise bills, not necessarily surprise bills, but facility fees and all these extra costs that, people are like now starting to maybe deeper dive into their insurance and realizing that, really insurance is for expensive things and not for your day-to-day care. You're still going to pay for it, and yet you're not guaranteed anything. And that this might be a better investment, is definitely a better investment for so many reasons. But I think, really kind of I think there was as I said, because I was kind of practicing this level, that the percentage of patients that I thought would switch over was not as high as what a lot of people assume would happen. And it's really just because that's the level of care I was providing. And then I had people that went out and then realized they weren't getting appointments, or were never seeing their pediatrician, or were going to the urgent care half the time, and it was costing them a hell of a lot more money. Sorry, I don't know if I should say that, but so they kind of then reached back up to us and joined the practice. And I do give them first dibs. So, when I open up spots, it's sort of to try to control how many patients, because I want to be able to offer this level to everybody. And, I don't want to tell them I'm going to offer something and I'm not able to come through with it. So it's been a transition. It has been a transition, but I think it's just really more the education.
Right. You also mentioned before we got on our recording that when you were transitioning your traditional insurance-based pediatric practice to a DPC practice, that you really didn't have a mentor or a coach to help walk you through that process. You kind of figured it out with, as they say, blood, sweat, tears, and elbow grease. And you figured it out and you're making it work. You mentioned that you've helped a few other physicians transition their practices as well, and this is actually turning into a new business for you. Can you talk a little bit about how you can now help physicians transition their practices to DPC?
Yes, so you're very right. So when I actually made the change and the transition, it was all, I tried to look and find and see if there was someone else who had done it. There was nobody. I wasn't able to find anybody who had actually transitioned. There were a lot of people who started from scratch, which is kind of different versus when you're trying to transition. Because again, when you transition, the goal is hopefully to be able to get some of those families to your new practice. And there is a way to do it. And I kind of had to learn on the fly, and retrospectively, I wish I had done certain things differently. And so I have and that's what I've been trying to do with I've had a few physicians, pediatricians across the US reach out to me to get information. And so, yes, so I have started a consulting for that, where I kind of created a roadmap for them of what to do for your assessment of your current practice, how to assess it, how to plan going forward, and then walk through the process of the transition and what it should look like. And again, the hope is to not have other people make a lot of the mistakes that I made, which would make that transition so much easier and save you money and time and energy.
And stress.
Big time.
One is a big one. So often we talk about hindsight is 2020. If I only knew then what I know now, I could have, bypassed that landmine and that problem and that mistake. Are you willing to share maybe one or two things, stories that if you knew then what you know now, you would be in a different position now? Any stories like that you might want to share?
So one story, one I would want to say is the people that you think will stay with you are usually the ones that won't. And the people that you least expected to stay when it costs them money on a monthly payment, stay. So I had a lot of Medicaid patients. So my practice was like 60-40 commercial Medicaid. And I have Medicaid patients who chose to stay with me because for them it was like, and I'm a Medicaid ordering referring provider. So, they can stay with me. They pay me the monthly membership. That's not something they would want to ever give up. They were like, I would rather come here. I know I get things done. It saves me so much time. And these are people who usually have small businesses. So I think that would have been something I would have liked to have realized, because again, you don't realize it, and then you don't want, and you don't want to take things personally. I think that's a big deal, because sometimes, you're like, what? You kind of start to look at it when people are like, well, I don't know. And you're like, oh my God, I looked after your kids for age. I mean, were you dissatisfied? And it's nothing personal. It's really nothing personal. It's just everybody looking at their own situation and then seeing what they need, and that's it. And I think that sometimes is another way, because that adds stress to you, when you're not aware of who may or may not, and your expectations are there, and that can kind of add stress and make you have negative thoughts and self-doubt, which you shouldn't have. So I think that would have been something that I would have liked to have had a better handle of at the beginning when I was starting.
Sure.
And I hope I can help other practices deal with that.
Exactly. So for physicians who are listening to this podcast sometime into the future, they might say, now I know that I'm not the only one that's going through this, or, don't make a big deal about it if the people that I thought were going to stick around don't, and vice versa.
Mhm.
What about people who are finishing residency and they're training and they're ready to start a business? Would you encourage them to jump straight into DPC? Or would you encourage them to maybe start a traditional insurance-based practice first and then transition later?
No, yeah, I would just tell them go into DPC directly. There's no need. There really is no need. It's DPC concierge. It's you have to, you can keep your overhead really low. I think that's a big deal. You want to keep. You can start very small. You are only going to be a small practice, so your overhead is really low. Create those relationships. You have time. As long as you have. So the thing is, it takes a while to grow. So you do need to have that financial, I would say, nest or something. You need to have some money. You can, before you can do this. So depending on your financial situation, I think that is important. And, to kind of look at if you can sustain yourself for a couple of years. As I said, there are people that start and it just takes off, depending on where you're at, depending on your reputation. And then there are others, which is like the general, it takes a while and you kind of have to get that momentum growing. And so you do need financial, if you're the sole earner and things like that. So people often will start a DPC, but then work, do other things on the side to supplement the income. I think that is a real situation. But when it comes to investing your time in a practice, I would say just do it DPC, spend your time, get those relationships, build the practice. It is way better and way, way better for you, for your patients, for your lifestyle. And you can do other things. I mean, in my practice, I do autism evaluations, I do ADHD evaluations. So patients do not need to be a member of my concierge. I basically am like the problem solver. So I look in my community and I'm like, okay, what issues are they having in healthcare? And then I'm like, oh, I can help people with that. Yeah, it costs, it's a cash based practice, but again, the perk is it's affordable and there's no wait time. So for those people that's what they want, then that's where I come in and do it. So I think just being creative, I think that's how you're gonna do it. But yeah, that would be my advice. Don't waste your time.
I love it. What size do you think for your business is a reasonable panel size so that you can still provide the excellent concierge level care without stressing out, but still making enough income to cover all of your expenses and obviously, have your personal income grow?
So I think that totally varies based on your pricing. So I think there are practices that are small. Like I know a couple of micro practices here who are for adult practices, and their pricing is more, not that much more, but it is more expensive per month. So their panel is smaller. If your pricing is lower, then your panel tends to be a little larger. But again, I think, on average, they say up to 500 is something that you could do when you're offering all that you're offering. But it depends on how you educate your families and what you tell them and what expectations you set for them. And then in my practice, I actually invite people in. So I make sure that they kind of understand, because it's like an interview that they're taking my interview, but I'm also taking their interview to make sure that it is a good fit. Because I would never want somebody to think I'm offering something that I'm not, or bring on a family that doesn't fit in, because I don't take non-vaccinators, and so I would never want to ask somebody to leave. And I'm like, everybody has their own choice, and that's totally fine. But for my practice, that is one of the things that I do, and a lot of people choose to join my practice because they know that we don't have non-vaccinators in the practice, to keep the kiddos safe. Because I have some kids who have health conditions that cannot get vaccinated, so their goal is to try and make sure that those kids also stay healthy. So I think things like that will determine. So your pricing may determine the size of your practice and what you're going to offer. And again, how much of the other stuff that you're going to do. You can make your practice size even smaller. So you can do whatever you want. And they always say, you've seen one concierge DPC practice, you've literally seen one. Because every single one of them does it differently and does what works for them.
Yes, I've seen that quite a few times as I speak to different physicians. Some which maybe call concierge and still do accept insurance in some levels along with their annual fee. Other practices that say no insurance, not at all, not touching it with a 10-foot pole. Others that provide additional services at discounted prices, different in-house pharmacies or Botox and some of the other type of services along those lines. So as you said, if you've seen one, you've seen one. And that's about as far as it goes. But everybody's different. What's neat about this is you have the flexibility of designing your practice the way that you want to do it. And if it works well, great. And if something doesn't work as you want, you can always tweak a little bit, change a little bit, and keep on going. As entrepreneurs, that's what we do. Little pivots, little tweaks here and there to get us where we want to go and to get the best outcomes.
That's right. That is exactly right. There's like 5 of us within a 1.5 mile radius, and there's one of us that does 4th trimester packages. That's her thing. There's another one that does just primary care. She doesn't do any other extra services. And then there's a third one that's kind of incorporating multiple things together. And then there's me. I do primary care, but then I also do autism and ADHD. Those are the 2 extra things because I had done my fellowship. We had a little more intense training in that. So you're right. It just depends. And I love the fact that you can do what you want to do. And you do what you do you. And, you want to work 5 days a week. You want to work 6 days. You want to come after hours. You don't want to. You want to go to the house. You don't want to. It's totally up to you as long as I would say the way you grow is you are very clear about it at the front. So that way because yes, the number one referral source is your current patient panel. And so if they're happy with what you're doing and you fulfill your promise, they're going to go and share with their friends.
Love it. As we wrap up our interview today, if a physician is watching this and they want to speak with you personally to just chat, to get an idea more in depth about your practice, in a desire to create their own DPC practice, what's the best way that someone can get in touch with you and schedule a chat?
So I have for consulting, for transitioning a consulting, I'm going to be starting that, and that's going to be on my website, and they can reach me via the email address on that. My email address is ida@pediatricpod.com. So I formally will be doing that. Will just really be for helping people who want to transition, and it's a 4-hour package that I give. But just for information, you can always send me an email, and my office number is 713-669-1900. My website is www.pediatricpod.com, and it literally is a pod. The reason I named it was because there's no space. It's just me and my patients, and there's nothing else in between. And so more information on that, but I'd love to chat and help. I really think this is a much needed change in our healthcare system. I think the physicians are great, but we would really hate to see the younger generation not want to do this, because that's what I'm hearing and seeing, because they're like, look at their parents. They're like, no, after so many years, and then you're working so hard. And so really kind of encouraging the next generation that, we still need good physicians. And there's a better way of doing it, which doesn't cost you an arm and a leg and gives you better outcomes for both the patient and the physician.
Couldn't have said it better myself. Wonderful. Thank you. One final thing I wanted to mention is that the marketing arm of my company, Concierge Medical Marketing, provides the different digital marketing services to help the concierge DPC physician to succeed in their business utilizing digital marketing methods and strategies. And the way we've structured our offering is based on one of 3 different programs. So the first is transition, for physicians transitioning from a traditional insurance-based practice to a DPC. The second is growth. You have your practice. Everybody who's transitioned maybe is already done. How do we grow? How do we get to 300? How do we get to 500? We have wonderful methods of helping achieve that for our clients. And then finally, nurture. You have several hundred families that are your patients. It's very important to stay in touch with them with emails, with text messages, newsletters, maybe quarterly get-togethers at the practice, and just helping people stay engaged with your practice. So we call that nurture. So we're able to help physicians with all three of these options. And as time and the practice changes, we can modify and pivot our plans as well to help the physician wherever they are. I've written a book called The Definitive Guide to Winning with Digital Marketing for Concierge Medical Practices. And that book is available for free. Simply go to our website, concierge-md.marketing. Scroll down the homepage until you see the book, put in your email address, and click the go button. And our system will send you a link where you can download the PDF. Please read it with my compliments. And if you have any questions whatsoever, if you have anything you need clarified or want to chat with me, please just reply to the email or give me a call, 772-304-2420. And be my pleasure to speak with you and see if I can help you in any way. With that, Aida, thank you for your time today. It's truly been a pleasure speaking with you, and I just encourage you to please keep up the great work with your practice, your families, and we appreciate you.
Thank you. And I just wanted to say one thing. I totally agree. Your marketing is key. Maybe I didn't mention it earlier on, but a website where you can funnel all your patients to get them to learn a little bit about you on a very personal level, that website can make or break your practice. So for sure, I think what you're doing is fantastic. And thank you so much for having me.
Truly my pleasure. Folks, we appreciate you being on the Concierge Medical Marketing Podcast, and we continue to interview wonderful doctors and folks that are involved in this industry. Please subscribe and like and follow us wherever you are. And with that, we'll call it a day. Have a great one, and thanks for following.
Thank you for tuning in to the Concierge Medical Marketing Podcast. Please subscribe and leave a review wherever you listen to podcasts, and stay connected with us on social media. To speak with Stephen Schwartz about growing your concierge medical practice, give him a call at
772-304-2420.
or visit our website at concierge-md.marketing. We will see you next time.